but we wanted to try to get people coming and going when they're leaving shifts and going home. We do have some questions that did come in, and so we are going to field those questions as well. And so just welcome everybody, and I want to introduce Dr. Joseph Berg. He has been with us now for going on 8 years. And I don't know if you want to just say a few words about the clinic and your thoughts about a new clinic building?
Sure. Was thinking about this and I have two thoughts. One, I'm excited for our community. Being here for almost 8 years has been great. I moved here when my daughter was 4 months old, and now she just turned 8. So that's been cool. We've had 2 more kids since then, and this is really our town. It's not quite far enough away from Madison to have its own like small community hospital, but it's not close enough to Madison for it to really be convenient. So I think it's really exciting for our hospital system to invest more in our community, to bring more services to our town. So that's really exciting for me. And it's exciting for me as a doc in our town, because when I chose Mount Horeb, I chose it because I wanted to be in a small town. And I think that our hospital is showing that we care about our communities, we want to invest in them. And that's exciting for me as a doc. That's all I want to say.
Dr. Berg has been a great blessing to our hospital. He has a growing practice, and because of his practice, we've been able to have a therapy center, as well as OB-GYN coming in now, and some other subspecialties. So it's growing just the way we had hoped. I also want to introduce Jim Massey. Jim is our board chair. He's been on the board now for 12 years and has done an excellent job, and was just reappointed by his peers as board chair to lead us into this next phase of building clinics. So Jim, I'm going to turn it over to you.
All right, thank you. Before I go too far, I'll introduce Sandy Fisher. She's our board rep from Mount Horeb here, and Sandy will be fielding all the questions.
I have to leave.
But our reason for being here today is because we are expanding our services in Mount Horeb, and as Dr. Berg mentioned, we've been here, and maybe Lisa mentioned, we've been here for 7.5 years, I guess, in our current location. We would prefer to own a building rather than rent, so we are looking at the new location. Our purpose here today is to identify areas for services to be offered at the new Mount Horeb clinic. So we will be fielding questions about that, and we have some questions that had come in during earlier a chamber event that I believe that we had here, or that we were part of in Mount Horeb, that Sandy was part of. So we will be looking forward to any questions and comments we have from anybody. So we're going to start with a video, I believe, right? So I'll turn that over to, let me see, Angela. Okay, there's Angela.
Hi.
Turpin.
Angela Turpin, I'm the Foundation Director for Upland Hills Health. Thank you everybody for attending. A huge thank you to Mount Horeb School for allowing us to have the venue, and also to the Ground Patrol for their delicious food, so please make sure that you eat before you leave. There's a lot of great food over there. As you know, Upland Hills Health has been there for every stage of you and your family's life, and we will continue to be there. We are a strong organization, and with your help, we will continue to grow stronger. We have just a short video that we'd like to show you with some of the services that Upland Hills Health provides to Mount Horeb.
Nestled in the beautiful hills of southern Wisconsin, there is a team of healthcare providers who value what you want in healthcare. Providers who listen, who want to know you as a person, partnering with you to achieve your best health. A hospital team that strives for excellence, exceeding state and national quality measures and patient opinion rankings. A health system that attracts the best doctors, nurses, and healthcare team members who come to work to make a difference. Healthcare experts who are as independent and forward-thinking as the system that employs them. This health system is governed by a community-based board of trustees that evaluate each decision on how they would want to be treated and cared for, because this is the health system they want for their neighbors and friends. And while not in Madison, this hospital team carefully surrounds itself with the same experts you would see in Madison. Madison emergency physicians, Madison pathologists, Madison radiologists, and over 20 Madison specialists on site in Dodgeville. All of the expertise without the traffic, without the beltline, without feeling like a patient instead of a person. What is this health system? Upland Hills Health. You might know of Upland Hills Health. You may have used services there. But the team at Upland Hills Health wants you to know everything about them. They want you to know everything that is available to you through Upland Hills Health. For over 100 years, the Dodgeville Hospital, Upland Hills Health, has been dedicated to providing the highest standard of health care while offering a comfortable, neighborly welcome to everyone who walks through their doors. While the year 2024 marks the 50th anniversary for this hospital, its origin goes back much further to 1912. In November of 1912, Sister Mary Benedict arrived in Dodgeville and began preparations for a hospital. St. Joseph's Hospital was built, and the first patient was admitted in 1914. 20 years later, Dr. Orrin W. Joslin built a second hospital in Dodgeville. General Hospital opened in 1926. 48 years later, the two hospitals merged. The new hospital was named Memorial Hospital of Iowa County. Through the 1980s and 90s, healthcare services grew as the hospital responded to the needs of the community. This included building Crest Ridge Senior Living, the culmination of a vision between local hospital Upland Hills Health and Elder Span Management to provide exceptional care and living options to seniors and their families. By the turn of the century, the hospital was serving an area that had grown well beyond Iowa County. To reflect their expanding embrace, a new name was adopted. Memorial Hospital of Iowa County became Upland Hills Health, and the decades that come brought forth unprecedented growth. The birth center expanded over the years to accommodate growing families. Several local family medicine clinics have been welcomed into the Upland Hills Health system to bring quality health care to rural residents of all ages. And as our community clinics multiplied, the hospital campus grew to include a nursing and rehabilitation center, dialysis center, heart, lung, and sleep center, and therapy and wellness center. A helipad was built to welcome med-flight services. Lab, imaging, emergency, pharmacy, and home medical equipment services were expanded. Through the years, Upland Hills Health has worked with local businesses, providing on-site immunizations, physical therapy, and other occupational health services to help employers prevent injury and promote health and wellness to the workplace. In 2017, a construction project that spanned 2.5 years began. On the hospital campus in Dodgeville, a new hospital patient floor was built with 17 state-of-the-art patient rooms, an intensive care unit, and new birth center with an adjacent C-section suite. First floor improvements saw a new state-of-the-art surgical suite and recovery area. The following year, the Mineral Point Therapy Center opened in Mineral Point, bringing an aquatic therapy pool to residents of Southwest Wisconsin, an exceptional opportunity for physical rehabilitation. This growth was made possible with community support. The most successful rural healthcare systems are those with strong community partnerships. Upland Hills Health is no different. There is no doubt the personal investment of the community enabled the growth that occurred to meet future needs. Today, Upland Hills Health is poised to deliver its vision, to exemplify the highest standard of community health care and inspire patients to take an active role in their health through wellness-oriented care. Upland Hills Health employs over 500 people. In addition to doctors and nurses, Upland Hills Health employs people with expertise in fitness, therapy, accounting, food service, marketing, customer service, administration, purchasing, science, logistics, construction, mechanics, data, technology, and much more. Upland Hills Health is nationally recognized for the quality of care provided. For years, the hospital has consistently ranked among the top 100 critical access hospitals in the United States and has received 5 stars, the highest rating in patient surveys conducted by the Centers for Medicare and Medicaid. With clinics in 7 communities and home care and hospice services that go where the care is needed, Upland Hills Health is bringing healthcare experts into smaller towns and villages to make getting the best care as easy as possible. You'll find Upland Hills Health clinics in Montfort, Highland, Mineral Point, Dodgeville, Spring Green, Barneveld, and Mount Horeb. Upland Hills Health Hospital in Dodgeville is the first rural hospital west of Madison on Highway 151. Many of the medical professionals available in Dodgeville are those also available in Madison. Upland Hills Health Emergency is staffed by Madison emergency physicians. Top-notch diagnostic lab and imaging services are reviewed by Madison pathologists and Madison radiologists, with results available quickly and efficiently through electronic medical records. Today, over 20 specialist physicians come to the Dodgeville Hospital campus, reducing the need for area residents to drive to Dubuque or Madison. Upland Hills Health is planning for the future, bringing care to rural communities where it is needed most and easiest to reach. Utilizing family medicine clinics to provide health education, increased opportunities for physical activity and social interaction, and services that support and inspire patients to take an active role in their physical and mental health. Upland Hills Health has been providing healthcare in Iowa County and the surrounding areas for generations, welcoming new generations every day. When there is an emergency, Upland Hills Health will be ready. When you need primary care or more specialized care, Upland Hills Health will be there for you. The mission of Upland Hills Health is to provide innovative, individualized, and compassionate care for every stage of life. Their goal is to be your first choice, always, and so they focus on exceeding the highest quality standards, providing price transparency, easy access, and caring for you and your family with warmth and compassion. After all, they are providing care for neighbors and friends. At Upland Hills Health, you will find healthcare providers who take time to listen, to get to know you as an individual and thoughtfully consider your health situation. Upland Hills Health supports these providers by collaborating with the best minds, incorporating the latest technology, and monitoring for quality to ensure the very best possible outcome for you. Upland Hills Health meets the needs of the community it serves by listening and responding. Voice your thoughts. Upland Hills Health will listen. Call their comment line at 608-930-7100 or send your ideas through the Contact Us page at uplandhillshealth.org or watch for an Upland Hills Health Community Forum scheduled in your town. Upland Hills Health Hospital and Clinics, providing innovative, individualized, and compassionate care for every stage of life.
All right.
What you heard?
So I'm Sandy Fisher, and I'm the Mount Horeb representative on the board. I've actually spoken at the Mount Horeb Chamber Breakfast as well as the Mount Horeb Rotary Club, so had some really good feedback from both of those groups. It's actually a really exciting time in Mount Horeb right now. This has been a great relationship between the clinic and the village. And we're really on a path of growth right now. And I was just reading, if you haven't seen the article, there's an article in Business magazine this month, and it is about Mount Horeb and the Chamber celebrating their 100th anniversary. And it talks a lot about the growth and economic development of Mount Horeb. And if you haven't had a chance, I'd highly suggest you read it. It's really exciting. And I think this is a great time for a new clinic. The community is growing. We've been here, 26 years. Yeah. So just have seen a lot of change in the community, which is really neat. We haven't always had our healthcare services here in the community. We've had to go to Verona or Madison, and now recently with the switch, we go to Upland Hills for everything, and it's really a lot more convenient. I will have to agree with the video.
not fighting the traffic to head to Madison versus the traffic going to Dodgeville, it's night and day. And the way you're treated is also night and day, I will say that. And just the experience that I've had with parents the last few years and the services they've had to receive at their age, it's just been a wonderful experience all around. So it's, you know, it's great for Upland Hills to be in a growing community. We want to be able to meet the needs of that growing community. So your input and what you'd like to see for your services, healthcare needs would be great to hear. So that's why we're here today, to get your feedback, ideas. We can share with you also what we've heard from some of the community members already. But we'd love to hear your ideas and any questions that you may have. There were some health insurance questions that came up, just information or questions about just some of the availability of the doctors and, you know, who would be at the new clinic and things like that. So those are things that have been on people's minds, so we'd love your input and feedback as well.
All right. So we'll, I guess before we start telling you about some of the past feedback, we would like to get feedback from anybody who's here and is interested in offering those suggestions. We'd like to know what kind of services you'd like that in our clinic that we may not be offering now, or maybe talk about the good things you like there now. But so anybody here who's I see a lot of familiar faces over there. Look like Upland Hills people, but they probably aren't going to tell us what they really think. But anybody over here that has a suggestion that they might want to offer or a question for us?
Yeah, I'll just talk real quick. This is kind of a trial run for 5 o'clock, right? So I think I'm just like Sandy. Like I used to go to the clinic in Verona and in Madison. I'm Melissa from MHTC, by the way, and on the foundation board. But it was so convenient to be able to go to Mount Horeb and to take, as my parents were aging, to take them to Mount Horeb and not drive them all the way to Madison or even to Dodgeville, just to have it so close here. But I've been talking about it with my coworkers at MHTC, and they're very excited about this. I think the biggest question I was getting from them is like physical therapy, because a lot of them had a knee replacement, hip replacement, and that's a big deal about getting in and getting their PT appointments. And so I think they just want to make sure that they were going to have that local, you know, ability to do that. So.
Yeah.
We can turn it over to Karen.
We have good representation here. Yes, we are definitely going to continue to have full PTOT and speech services at the new clinic. So yeah.
Yeah, and that's basically what I had told them. But I know that that's probably, you know, a big thing on people's minds because it's just going to be that convenience of being able to do that locally. And then also, like our CEO and everyone else, and just supporting local. They want, you know, the hospital to support, or the clinics to support the local businesses, and in turn, you know, have our employees support local as well, because that's a very important piece, I think, of Mount Horeb for all of us to support each other.
One thing I'd say in that regard is we have been giving the flu shots and doing some employee occupational health with Duluth Trading Company and with others in this area. I know, Dr. Berg, you serve as the medical director at the, is it called the assisted living?
Kind of.
Yeah.
They've had some changes.
Okay, but served as the medical director, as the assisted living center here in town.
I help them out stuff,
And so we are very open to, we love working with business communities. We also just had a grant for a mobile clinic. And right now that's under a grant period where we can only use it for vaccine awareness, not just COVID, but all vaccine awareness. But when we get through this grant period, I know we're hoping to be able to take that to local businesses so that we can do some employee health and some vaccines, and particularly too in schools, so that we can do some school physicals and school education programs. So we're very anxious to do that. Chrisanne is over that van as well. So I don't know, Chrisanne, if you want to add anything to that.
No, I think you hit it on the head. We were grateful. It was part of our rural health clinics. We were able to apply for a grant through our rural health clinic status from some of our clinics, and it was on vaccine confidence, and so we were able to receive enough money to, part of it is not just the van, we've also been, if you've seen the billboards about say yes to vaccines, things like that, that's part of the grant as well. But we designed the van in order for it to be multi-use, not just for vaccinations and vaccine education. So eventually we should be able to take it out and take it to those locations that Lisa stated, so it's very exciting.
I can't remember the specifics, but I know we have sometimes partnered with the school district too, and we hosted a jump rope event with Jump for Jill a couple of years ago.
Mm-hmm. And the foundation paid for that in the school systems too, so that was great. Good question, but if anybody has things that they'd like us to do too, we're eager to hear about those. So you can just call the hospital, ask for administration. We'd be happy to work with you on community education or community-sponsored events.
Okay, other feedback here? Anybody? We had our Interpoint meeting a couple weeks ago. We planned this to have this little presentation at 4 o'clock and then one again at 5 o'clock. We had a much bigger turnout at 4 o'clock than we did 5 o'clock, so maybe we'll get the bigger turnout at 5 o'clock this time. But yeah, that was over there. There was concern about us moving our clinic from downtown to the edge of town, and I don't think that concern is here because it's not that's not the case of what we're doing here. But maybe you can go over some of the questions that
Sure.
we
Just some suggestions on services that did come up from the other groups. They would like to see more services geared towards geriatrics, mental health, and pediatrics. There was also mentioned at 2 of the separate meetings, they would like our services expanded to holistic offerings, was a suggestion. At both meetings, 24-hour urgent care came up, and they would like to see that as part of the new clinic. Also, the capability of having x-rays done in Mount Horeb versus having to go to Dodgeville, so that was a suggestion. There was a question in regards to orthopedic services has been an area that we would like to bring to the Mount Horeb Clinic, and that was the question came back, what would be the scope of orthopedic services offered? And so I'll direct that to Lisa so she can answer that question.
Let's Dr. Berger like to
The
answer.
scope of orthopedic services? Oh,
I know that Dr. Villari, who is our orthopedic surgeon on staff, would like to start coming
Right.
out here a couple of days a month
Yep.
and try to grow his practice here as well. In terms of actual procedures done here, they probably would be doing procedures here, but they would be doing clinic care and follow-up care
Right.
for anything to do with joint issues. Dr. Villari is an outstanding orthopedic surgeon. He came to us through the Mayo Clinic system and immediately wanted a Mako robot because he likes doing robotic surgery, and so the board financed that. And we are doing robotic hips and robotic knees, and we're doing shoulders now as well. So very skilled, we've had really good outcomes. It says a lot when your own staff and board members go to your orthopedic surgeon and others do. So we're very, very pleased with that.
At our last board meeting, I mentioned that Ted Greenheck, who's the vice chair of our board, is having a knee replacement done in March, and I'm having one done in April, so I asked if any of those board members wanted to offer a limb for the cause. But anyway, I'm looking forward to it being not hurting all the time. As far as x-rays, we do plan to bring x-ray services over here to this clinic, so that will be we figure we're going to be close to soccer fields and all the ball fields up there, have a broken limb now and then. And as far as urgent care, we are looking at likely bringing urgent care services here as well, but I don't know about 24-hour right off the top of the head, to begin with. I mean, you never say never, but we probably would expand our daily services to 9, 10 o'clock at night, something there.
And we have already purchased the x-ray equipment for Mount Horeb, so it will definitely be in place.
I just have more of a question, I think. I'm excited at the prospect of there being a new clinic in town. And my question's just based on my experience alone. So I have 2 children. And we've been provided excellent care. This is no disrespect to our current providers. But one of the growing frustrations I've had over the years is just simply every time I make that call and push to urgent care, or because I can't get in. So I'm just curious what we can maybe anticipate from an experience standpoint, that if I call, maybe it's an ear infection or something, something like that it's not really urgent care worthy sometimes, but I keep feeling like I'm being forced to urgent care and having to drive to Madison for urgent care because I can't get in at the clinic. So just curious what the experience is with that kind of, if I call, can I get in? Can I get them in the same day? So that's just one of the frustrations I felt as a parent, just constantly being pushed off and not being able to see my provider.
So I would say we're adding more physicians and providers to the clinic. We recently added Dr. Altman, who is new to the clinic. We have more visiting specialists that are coming out, and now we're looking at hiring even additional providers for those expanded hours. So it's called urgent care only because it's after hours. It really isn't like an ER. It will still be the clinic itself. But we do hear the demand. Dr. Berg's practice has really grown tremendously, and so we are in discussions now with 4 physicians, 2 of whom can start in 2024, 2 of whom can start in 2025, and they are outstanding physicians. The thing that we're really blessed by is there are a number of physicians now that are hearing some difficulties in working in larger systems, and they really want to have more of a voice in how their practices are run, more of a voice as Dr. Berg has in how the clinic is designed. And so they are seeking out independent hospitals that have a reputation for high quality. And so for the first time, I've been a hospital president now for 30 years. For the first time in the past 5 years, we have not had to hire a recruitment firm for family practice physicians. They are coming to us. And they are the highest quality physicians. I mean, we have every physician that's on our staff, and this is the first time I can say this in a hospital, I would go to any of them because they are just superior. I don't know if you want to comment on that.
I think from the recruitment side, that's been fantastic. I think to answer your question specifically, as a group, we continue to grow, and Lisa and I, comment all the time. When I started 8 years ago, working to be employed by the hospital, it was me and one of another recent graduate from residency and 2 older physicians who were retiring very soon. And so, we started from nothing, from something, making a primary care clinic, and it's grown to 7 facilities and all these docs at mid-levels. And there's been a lot of changes and growing and trying to figure out the best way to meet all the needs of not just Mount Horeb, but Barneveld and Mineral Point and Montfort. And, I think as that continues to evolve, we'll get better. We'll get better at fitting people in the same day, finding the right place for you, making sure our schedules are better optimized so we can see those same day patients. And part of that is continue to involve triage nurses and care planners and better schedulers, and that's all changing and getting better as we continue to grow. And because this has all been changing in the last 3-4 years, and the pandemic just kind of blew all of that up. So it all depends on how we continue to evolve. And I think that's a goal that we all have in our clinics. We have lots of our clinic people here today, and they're hearing this in the ratings down here. But yeah, that's a personal goal of mine. I mean, for my patients, if there's a kid that needs to be seen that same day, I will see them no matter what. I think we have Dr. Altman's newer physician is doing a great job growing that practice. And I think what I'm personally pushing for in our new clinic is space for enough providers, having enough people in the clinic to meet the needs of our community. As it continues to grow, I think that's what we're planning for, and what we're all hoping to do is to not just have enough now, but room to grow if we need to continue to grow.
To play on a little bit of what Dr. Burke had said, I'm a patient of Upland Hills, and I have 7 children. And he's absolutely right. Anytime that I call and say, Joe has a cold, I need him to be seen, or hey, always get him in. And not because I'm an employee, there's 600 employees, so we don't know everybody, obviously. But they are wonderful at, let me get you in, or, you know, Dr. Burke's out today, let me see if Dr. Altman can get you in. And they are just fantastic. I can't say enough great things. I trust them with my life.
Literally.
Literally, yeah, my kids are my life, and I trust Dr. Burke.
There was one other question, and that regarded insurance offerings and what was covered by what group. This happened to be specifically about courts insurance, and wondering if there's a difference between Dane County and Iowa County. It was a question I was unable to answer, so I'll let Lisa take that one over.
Okay, I'm going to start, and then Carl, our CFO, is here, and he can say, well, that's not exactly right. But Courts has several products, as does Dean Insurance. Each of them have a product called Dane County. They actually labeled their product Dane County. Originally, when we came into Mount Horeb with our clinic, the position that each of them took was that if you had a facility in Dane County, you were eligible for that insurance. But after we opened our clinic, they corrected that and said, and they each corrected it and said, no, you have to have a hospital in Dane County to have your patients be able to have that payer. So what we continue to do is to direct our patients to talk directly to their employers and to the insurance companies to tell them they would like to open access to the Mount Horeb Clinic, because we are very much in favor of that. We have lobbied for it, but it's much more impactful when the people who buy the insurance make that appeal than those of us who receive the payments. But I know Dr. Burke has asked us to look into it several times. We've looked into it almost annually, but we continue to ask our patients to lobby on our behalf. I don't know if you want to add anything to that, Dr. Burke?
No, I think you had it right. It's frustrating. We still get, several people a week that come and don't have our insurance or aren't covered. And most of the time it's that. It's the Dane County specific courts, and they were actually told by courts that we would be covered, but sometimes they're not right.
Yeah.
Because we know we've had this unfortunate, them get bills and stuff like that. So
Just urge people to
Yeah.
have their employers call,
Yep.
because eventually that wall will come down.
Yeah.
It just hasn't yet.
before you agree to switch, call and ask directly and do your best to do due diligence.
And just to clarify though, there are courts products.
Oh, most
that
courts
we do
products.
take.
I would say
And
most
the
of
hospital
our,
takes courts.
yeah.
It's the Dane County
There's
product.
Dane County specific product and like one or two specific Dean products that we don't take. And those are for, if everybody knows what managed care is, they want the insurance product wants you to see a certain number of providers because that's cheaper for them. So usually the cost of that product is a little bit cheaper. So if you open it up to a larger pool of providers, it might cost more, but you'll have a larger pool of people to go after.
Carl, did we do okay with that?
Yep. But I would say, I think most people would be surprised that we take most insurance.
Yeah.
If you go to UW, you mostly take quartz, and almost all SSMD products we won't take. Go to SSM, it's the opposite, right? When you go to us, we take GHC, we take most quartz products, we take most SSMD products, Blue Cross Blue Shield, Medicare, Medicaid, United,
John Deere. Yep. We took them all.
Cigna, I don't know. Humana. Anybody else got anything?
We have, it's Andrea, right? Mm-hmm. Andrea is representative of our architect here in Mount Horeb. And they're also doing our middle point design over there, so I don't know if you want to say anything about what's going on. But anybody got any questions for Andrea? That would be good.
I think that might be easier if there's any specific building questions then to answer those.
I don't have any building questions, but I want to clarify. Sandy did say, would we add geriatric specific surgery services or pediatric specific services? And I would say in terms of adding like specific physicians, no. But I would say that we are committed to adding providers to meet the needs of our community, and we employ mostly family medicine physicians. I think most of the people in Southwest Wisconsin are not like new to this, as your family doc takes care of you from birth to death, and that's what I think our hospital has been committed to, and I think we do very good job taking care of all ages, including, right after you're born, we see your baby in the hospital too, going to the nursing home, and unfortunately you're unable to stay at home. And everywhere in between. And I think we work really hard, and we've been really fortunate to find really great family medicine physicians to fill those roles and to perform really good quality care.
The other thing I would say that is a little bit unusual about our practice and our group, and I find even going to 2 other states, it's very unusual, is that usually today, if you need to speak to your physician after hours, you're referred to a national chain to talk to a nurse. Our physicians take call. They don't necessarily all love to take call, but they all take call. And so if you have a question after hours, they're able to look at your medical chart. They're able to talk to their partners. And so when you see the video that shows that we truly know our patients, we truly know our patients. And it is very unique, having come now from a hospital system in Iowa and Missouri, to have physicians who are still willing to support each other and take care of their own patients after hours and on weekends.
I had a surgery at Upland Hills several years ago, and my surgeon gave me his number in case I had any issues. And I was like, really? That was awesome. And I didn't have any issues, but.
So you also sacrificed a limb for that. Okay. Anybody else? We're going to do this little presentation again at 5 o'clock, provided we have different people.
But do stay and have refreshments, and we're here to talk. Dr. Berg is going to stay to talk. Our architects are here. So I just want to throw a couple of questions to you, Andrea, that came out of the last one.
Yep.
And that is, where do you see us in the range? Is this going to be 2 years, 1 year, just within a range? I know not specifically a month of when we might be in this clinic building.
Yeah, I mean, our goal is to be the beginning of next year. We opened up. Obviously, the design process is underway, and can't tell you what it looks like right now. But yeah, our goal is the beginning of 2024.
And then the other question that we had is in terms of coming in with a cookie cutter approach, or really getting the input of the patients and the physicians, what your approach has been.
Oh yeah, we have sat down with Upland Hills and heard what Jim and Lisa and Dr. Berg all had to say, and other physicians, other members of the Upland Hills community, to really get a full impact. DWBR don't design anything together. We really take time to listen to what the community and what our clients are asking for, and we want to make sure that we're creating a product, essentially, that you're going to be happy with and that you're going to use. It wouldn't do anybody any good if we designed the same exam room for Upland Hills that we did for another client, because you don't work the same.
Then could you just explain kind of your philosophy in terms of energy efficiency and designing buildings that really address the environment?
Sure. I was actually on a call today with some coworkers on how we can make bigger steps. What can we do as a baseline for all of our buildings, that we believe in building not just more efficient buildings, but healthier buildings. Simple things like relating to sunlight and making you can call it anything from a comfort room to a mother's room, whatever, but providing spaces that support everybody, kind of thing. So it's kind of a basis of what DWBR does, but then working with Upland Hills to determine what items you feel are important in that design as well. So it's not just what we feel is important. We can give Upland Hills ideas and suggestions, but it's also what best fits your building and making sure that it fits your community and users at the end of the day.
And then lastly, do you want to address Mount Horeb has some pretty strict building codes and also some design codes, and how we are working with the city to address those?
Yep. So I brought my colleague David Montoya, project architect. He has reached out to Mount Horeb to make sure that we understand what their requirements are, what they want the building to look like, and we will submit through the proper channels and have open discussions, not just a checking of the box, but let's talk about this, let's make sure that the solution works for both Mount Horeb and Upland Hills. We want to, you know, we believe in providing for the community. We don't do cookie cutter for that reason. You can't just pick up a building in, I don't know, say, Appleton, Wisconsin, or Minneapolis, Minnesota, and drop it down here. It's not meant for that. We listen to what everybody has to say, and I know Mount Horeb has some very strong values, community values, and we have noticed those. We've gone and done the research to understand what you want your buildings to look like, and we set to design it that way. The Mineral Point and the Mount Horeb projects we're working on are they will look very different. They could be exactly the same program. They're not, but they will look very different for that reason, because it's about the community, not about a building to fill a hole.
Can I add to some of that? We've been blessed with the fact that we work in various communities. And we don't have the same luck as Dr. Berg to live in the community, to usually know what's happening. So it's always ideal for us to connect with the community. I've been in touch with the city administrator and asking loads of questions. It's been really helpful and guiding us through. Obviously, things like this and the communication that we have with you and your team on, how you see your patients, how you work through your spaces, that's what gives us the insight on how you use the space, and that it's going to be something that's welcome to the community, not some foreign, which as a matter of fact I'm foreign, so not some foreign architect came and just put a box up here, it's going to be possible. And I think I want to add on the sustainability end, actually we're, as a group, as a team, as a whole, we've been trying to do a big effort to make sure that we have the labor that is local, and the materials that we're going to use, that we have the local expertise to be able to build this. So it's been really a good synergy is kind of the word I like to use, where we work together. Nothing comes from our heads, it's just all together. So I think that's what's important, and this is part of that togetherness, getting the feedback from the community.
All right, thank you. If you came in late and want to stick around for the 5 o'clock, same thing there, and just feel free to do that. Otherwise, help yourself with some refreshments, and we'll thank you for coming, and look forward to working with your community.
Yes, thank you very much.